And with Thanksgiving coming right up, a lot of us are looking forward to gathering with family, but also indulging in those festive meals.
Yeah.
But as we enjoy the holiday treats, it's important to know that not all chest pain is the same. It could be a sign of heartburn, or it could be something more serious, like a heart condition.
Yeah, and both of those things are pretty common actually around holiday times. Joining us to break down the differences between heartburn and other heart-related symptoms is Baylor College of Medicine Associate Professor Dr. Maya Balakrishnan. Thank you so much for joining us.
Good morning. I'm delighted to be here.
Well, first of all, can you tell me your specialty? Are you a GI or cardiologist?
Yeah, I'm an adult gastroenterologist.
Okay, so for our viewers, can you explain what heartburn is?
Oh, absolutely. So heartburn is a symptom of a digestive issue called gastroesophageal reflux disease. So it's caused by stomach acid backing up into the esophagus. It's a pretty common symptom. It's a burning sensation in the upper abdomen, chest, or throat. Sometimes people might have a sour or bitter taste in the mouth. Heartburn, these symptoms usually occur after eating.
Eating any certain specific types of food, doctor?
Yeah, so heartburn is usually triggered by eating certain foods, and it's a little bit different for everyone. It can also be triggered by certain behaviors like lying down soon after a meal. So some common foods that trigger heartburn are things like spicy foods, citrus foods, especially tomato-based sauces, caffeine. Alcohol can do it, chocolate. Also, fatty foods can do it. Basically, all the good stuff that people are surrounded by during Thanksgiving and Christmas time. And also the other thing that it can trigger it is lying down or bending over soon after eating, especially a large meal.
So heartburn is different from like having a heart attack or something like that. But since it's in that general area, there are some symptoms that people might confuse it for. Can you talk about the differences? Like basically, how would you know if you were suffering like from severe heartburn, or if it's something more serious like a heart attack that you should go to the emergency room for?
Yeah, totally. That's a great question, because both heart conditions and gastroesophageal reflux disease can cause some discomfort in the chest area. So heart conditions are things like angina or heart attacks, and they involve problems with the heart's blood supply, and they're potentially life-threatening. So they can cause also chest pain. The chest pain is often associated with pain that also radiates to the chest, to the jaw, to the left arm. Often the pain is accompanied by additional symptoms like trouble breathing, feeling dizzy, cold sweats. But it may just, angina may just present with chest pain. I think the big difference is that heartburn tends to happen after eating, and chest pain from heart conditions can happen randomly or when someone's under exertion, like when they're walking or they're stressed out. It typically doesn't just happen right after eating.
And then, obviously I would think we're talking about this because people may think like, oh, it's just heartburn. Yeah. I'm ignoring that as I lay down after my big Thanksgiving meal. But can you talk about, does heartburn can it contribute to more serious health problems?
So heartburn, if it's a chronic problem, so some people get heartburn sporadically, and then there's other people who get heartburn 2 or more times a week. In those people, it's important to get medical attention for the heartburn and get on medications to control the heartburn long term, because it can cause some long-term complications like something called esophagitis. It can even lead to some precursors of cancer in the esophagus.
Yeah, I mean, esophageal cancer is something that, we take very seriously. And I think that people, like Amy said, don't take heartburn very seriously. But if they treat their heartburn, like say there's somebody who gets it a couple times a week, if they take over-the-counter meds, will that help prevent the more serious complications?
Yeah, so you can take over-the-counter medications for some sporadic symptoms, right? So there are people who get heartburn after they eat very specific medications once or twice a month. For people who are getting heartburn more frequently than that, and it happens despite avoiding trigger foods, or they just can't avoid the trigger foods, then it's important to get on a medication that can prevent heartburn. These medications are called H2 blockers. There's another group called proton pump inhibitors. And yes, these are quite effective for preventing heartburn symptoms and controlling the acid and preventing complications.
All right. Lots of good things to keep in mind as we approach the holidays. So pay attention and maybe also schedule a visit with your doctor.
Yeah.
Get that frequent heartburn.
Dr. Balakrishnan, we appreciate your time this morning. Thank you so much for joining us.
Thank you.